computer. Because work cannot shift without a computer. And me being that actually I'm not a technological person, so I really need a computer in my house. One, I hold very expensive phones, but I don't know how to utilize them. For example, I'm a person who really wants to work, and actually I don't have any time for work. I can decide to wake up at 2 a.m. and actually work, but I cannot work on my phone. And also computer stores a lot of information. For example, if I want to retrieve, say, a concept note, a budget, or even actually go through my pictures. I'm a person who loves pictures. So sometimes my phone is full to capacity, so I transfer some of the pictures on my laptop. Brant is a jolly person. Jolly. I think that's why I'm not aging at all, because I really love to look after myself. Many people have actually who have interacted with me know Brant. I walk into a room and everyone will say, wow, Brant is here. I learned that from my mom. My mom actually, she made 74 years in January, but when you look at her, you might think she's 40. Why? She loves to look after herself. And that is me. Because actually you would never expect to see a lousy Brant. No. And even if you visit me, you will get a chance and come to my home and see. It's a very lovely place. It shouts Brant. Yes. And I also love dogs, because actually they keep me going. I'm not a person who actually runs to a clinical psychologist to get therapy. I have my own therapy. If I'm stressed, if I've had a lot of challenges, I go and question my dogs. I'm like, this thing happened, this also happened. And when my dogs actually bark, I'm like, okay, they have understood. And that is it. A younger Brant was, how do I describe myself when I was young? Because I'm still young, but those years. I was ignorant. And when I talk about ignorance, it's about ignorance in health. Also, I remember when I was actually, when I had sat my PLA, that is P7 in Uganda. One of my brother had actually was HIV positive. But then I didn't know what was really happening to him, because I used to see people segregating actually his beddings, utensils, basins, and they couldn't actually allow us to come closer or get closer to him. So by that time, I didn't know what was really happening. I didn't know about this thing about HIV and AIDS. Yeah, we had that thing of PLEs, social sciences, social studies, mathematics, and actually RA. But we couldn't actually know what the world or people meant by HIV and AIDS. So that was a young Brant. And actually that's the thing that actually brought me into activism. Because I remember when he died, my siblings asked me, hey, you don't know people who die. Your brother is gone. But then the challenges he went through, actually triggered me to look for more information and not being ignorant. So when he died, we buried, and actually it started the thinking of actually what can I do better? How can I define this disease that actually can make you not even actually, have a closer interaction with your sibling or your siblings or your loved ones. For me, when I was growing up, I wanted to be a doctor. Because one, I had actually, I had this actually knowledge that actually doctors are always smart, they look neat, and they are ones that actually they put people, they bring smile on people's faces. So when I grow up and actually I saw that the journey of becoming a doctor was a bit challenging, so I used that turning point to become a doctor. How? To say, and then when I build on that, I'll build on the case I've told you about my brother. I keep on relating to him. So that's when my turning point actually happened. I'm like, okay, let me go and find out what HIV and AIDS means. Because you remember we have free medication, ARTs free, but then some people, even at this era, don't know where to get those ARTs. For example, for me, I'm a city born. My dad, Najanankum, my mom, Zambia. I don't know any kind of village. So, if someone in Zambia they didn't know about HIV and AIDS, what of some people who come from far, from Kampala? So that's when my turning point came, and actually that's when I joined activism. I didn't join activism because I was queer, no, but because I wanted to know what kind of disease that actually can make someone actually die without even getting treatment. And then, surprisingly, I joined my favorite organization, and then actually I started. By then, when I joined the organization, I didn't actually tell them why I was there. I started as a volunteer. Volunteering in doing what? Cleaning the offices, windows, making people breakfast. But then my passion was actually more into health. So I volunteered for 2 or 3 years. And so there was a project, actually, one of our sister organizations I was mending, that is Freedom and Rome Uganda. They had a project of hate no more. But because I was too active and passionate, so they like, okay, Brant, there's this project, can you be part of it? I'm like, yes. We went actually across the whole Uganda, actually sharing lived realities of queer people in Uganda. So the IBU management by then actually brought up an initiative of opening up the first ever LGBT clinic. But because I was too active, I didn't even go through an interview. The clinic was set up, May 19th, 2012 or 20, yeah. I'm not so certain about the year. And they appointed me to become the clinic manager. So that's my dream came true now, because I was passionate about health of people. So I started being a clinic manager. So that's when my career of a doctor comes out now. Because if you don't, you might actually describe me without putting the name Musao. You might not get me. So I started. I went through capacity enhancement. I went through reading. Yeah, by that time I was a young person, and everyone was surprised of actually seeing a young person who is really dedicated and passionate about key issues. It was really a challenge in our years. So I started reading through HIV, and then that's when I got to know that my brother passed on, because he had no information, he had no moral support, he had no mental health support. What he felt was discrimination from morning to evening. Yeah, so that's when and I was like, no one deserves to die without knowing the information, without knowing what is actually, without knowing about the disease you're going through. And then actually, I also always actually kept on sitting in my living room like, okay, 1, you're queer. 2, you're HIV positive. 3, you're discriminated. 4, you don't know where to go and get any kind of support. So when I related to the passing of my brother, it really actually triggered me to work more closely. That's when I started actually reaching out to other mainstream organizations as Brant. Now I used to go to mainstream organization as Brant, not as IBU, to ensure that I first build rapport before I bring in the IBU bit of it. Why? Because I wanted to know, if you're HIV positive and young, yeah, how can you be helped? How can I, for example, if I'm tested HIV positive today, how can I disclose to Samantha that I'm HIV positive? Or how do I get courage to go and actually access or seek for help? Now we're seeing now having youth dialogues, of which these youth dialogue used to bring a lot of queer persons, lesbians, gay, bisexual, transgender person, young LGBT person, as they call themselves, in the same space. Now I got the opportunity to bring out to bring some of the people that have worked with mainstream. When I talk about mainstream, this is Ministry of Health, Uganda Commission, an organization like TASO that actually are working, have been working so with the people living with HIV. So I went, I wrote them an email. I'm like, we're having this kind of discussion to talk about how do you come out? How do you disclose your status? If you're HIV positive and don't know where to go, how can you seek for support to ensure that you get the information, the medication you want? So and then actually the way we conducted those dialogues, it wasn't about sitting in a classroom area. It was at the beach to ensure that everyone actually wines as you take a cup of tea, as you sip on a glass of wine, you can grasp a lot rather than sitting in a workshop setting. So people started sharing how they got an HIV, how they contracted the virus, how do you disclose if you have a partner, because actually we used to have those questions. Yes, for me, my partner is Ruth. Yes, but how do I tell Ruth that I'm HIV positive? Remember, Ruth is supporting my rent, tuition, and we have businesses with Ruth. So how do you disclose? So we brought a lot of people sharing experiences, and now that's when we see now queer people starting to come out to stand actually comfortably and speak about their status. That was because of me. Sometimes I sit, I'm like, I need an award because I've really done a lot of things. So we start seeing people coming out and actually comfortably with their status. Now we start seeing people actually forming post-test clubs, whereby these are queer people living with HIV, sharing their experiences. I received every day phone call. I remember there's a challenge we had whereby in 1 year we lost more than 5 to 7 people over HIV in 2 months' time. Why? Because discrimination, they didn't know what to do. And these are challenges I've shared. So we start seeing people coming up. We start seeing people comfortable with their status. We start actually seeing people calling me. You know, Brant, ABCD, Brant, I started my medication last week, but I felt like this. Is it because I'm going to die or what? So they started actually seeking information on how the side effects of ART, and they started actually talking about sharing and seeking information on what that is. So we see, and then the other challenge we had is actually sexually transmitted infections in queer community. Because I remember that time we used when the clinic has just opened, the clinic was just for STIs. That shows that actually we are really doing bad. So each time someone, I'll give a ratio of 1 to 10 of the people that used to come at clinic. 8 of them had one or 2 STIs, which shows that people were self-medicating, people didn't know where to go, and people feared to go to mainstream. For example, if I've had sex with a queer person and I've gotten a complication, by that time, how could you go to Rubaga Hospital, for example, and then say, you know what, as Brant, a gay man, I had anal sex and I got this? People didn't want actually to. By that time, things were really, really bad. The good thing, people have been, we've done advocacy, things are slightly changing, but actually years back it was really a tug of war. People used to self-medicate. You're like, hey, for me, oh no, Brant. I remember when someone was exposed, and actually exposed, I mean actually he had unprotected sex, and then actually when he was going through his partner's bedroom, he saw the results. The results were reading reactive. That is HIV positive. So it was really up and down. It's like, Brant, can I talk? Can I? Do you know someone who's HIV positive? I'm like, yes. Ask them to give me one of their tablets, because they had read about PEP. So he thought, since PEP is like ART, he thought taking ART is PEP. So that's the sum of ignorance that the queer community had. They didn't differentiate between PEP, PrEP, and all that. So we see now a challenge of self-medication. Because what are you medicating? You don't know what you're really medicating. So there are challenges that actually brought Brant to come out broadly and brightly to speak about health of queer persons. The journey is a bit unique, because from Brant, who was actually a volunteer, to a clinic manager, that was smooth for me, because that was my calling. I really wanted to be a doctor so much. Yeah. So that, however much challenges I saw, because actually the first person I see, for me, the first dead person, the first time I viewed a dead person, it was through my career. It was through my activism. For me, I'm a prince. I didn't know how a dead person looks like. I didn't know how to go to these hospitals. But because of the calling I had, so I started seeing now dead people. And the first person I saw, really, I went through trauma. And by that time, we didn't know even the definition. Did we even know the meaning of mental health? So you're like, okay, you go, your superiors send you to Mulago, you go to the mortuary, you view, and then take, after what? You go back home and sleep. So the depression was really real. So I started learning the journey. I remember actually I was working with Mappy, and one of my friends, Majo, told me, because when some of my queer people passed on, so I went there, I was emotional. I couldn't go, that means a doctor can what? A medical person died, and so that ensure that actually you're emotional something. But you couldn't keep the emotions, because you're part of the community and seeing the community people die. So when I was still stabilizing, knowing more, sitting on different steering committees representing queer people in terms of health, and then actually now the transitioning coming at my organization, Icebreakers Uganda. The old management is leaving, and then they need a new management. And by that time, I didn't even think that I would be appointed as what? For me, I kept on saying, we need a new director. For me, with health, I cannot what? I cannot leave my passion, because actually health is my passion. So after a week or two, I'm called by our founder, that is Dr. Frank Mugisha, and then says, what? After consulting, you've been appointed as the new executive director of Icebreakers Uganda. It was a challenge for me. It was challenging. Now I started to know, okay, I'm transitioning from actually being a clinic, not only being a clinic manager, but also from the health bit of it to a management bit of it. Remember that time I was putting people on pressure. You know what, Dennis, we want ABCD. Someone cannot take their medication without eating. We need management. What are you doing? Now I'm the management. And by the time it was really, really a challenge. Our organization had gone through some challenges, big challenges, and now I'm there as the new executive director. People are looking at you. People are looking after you. And I'm like, okay, where should I start? I've been holding people accountable. Now they are going to hold me what? Accountable. So I start the journey. It was really a hard journey for me. The organization did have a coin. We had dates, areas, but it's the areas Muluzung grant for a year. We got eviction letters. Then I've been summoned in court. Yeah, people were not paid the previous year. So one of the staff members summons me. So a lot of challenges. So I'm like, okay. And then I said, can I give up? Since I have a passion in health, can I actually do it with Icebreakers Uganda and open up a new clinic? Since I have a passion for clinic. But then what I should tell you guys, whatever department or transitioning going through, you need actually support. I had support from my friends, because they kept on saying, no, Brant, you can do it. Brant, you can do it. Now, that's small, you can do it. The support I had, every time I woke up and I'm like, okay, let me give up. they gave me support. And then some people, went further to, because I love my life. So they went further to the, okay, Brant, this weekend we are taking you out for ABCD. When you go out, after a few drinks, they start work. But when you can do it, if you manage the clinic for those years, but you can manage management what? Waking up a day and you get like 20 emails. This one is asking for that ABCD. That was a challenge. But what I need to tell you is you need support. Because it's hot in there. I'll not say. Sometimes many people actually ask me, but Brant, do you get pissed? I do get pissed. But then if you get pissed, and then what? The organization gets mad. So I got support from my friends. Because actually with my friends, you can know that journey or the life of Brant. So they pushed me. I remember the first grant I got as the executive director, it was just a phone call. Because I had made partnerships, stronger partnership, and strategic partnerships. They called me, Global Fund. They gave me 50,000 USD without letting me know, without me bidding, writing concept, no, because I had made my strategies and made my partnership strong. They, on a phone call. So I'm like, okay, this is good. So we went on, and then I had to recruit staff members, and then you recruit staff members, and by the time the recruitment is done, some of the projects are ending, and then you have a whole 17 people that are on your head. So why am I giving all that history? That people need support in their transitioning process. Because you might not know what is really happening, but actually the support, the little support I got, is where I am. That's why I always say that actually these young leaders, every young leader that comes up, let them have support. Because what I'm seeing in my queer comment, and I will not fear to talk about it, some young leaders are entitled. They have the level of entitlement. And actually sometimes I sit and laugh. Because for me, if I got the capacity into the capacity building into leadership, I would be the best leader. But I learned from Job, you have to do this. I remember asking Frank, how would you write an official email? Like, you know what, I wrote several emails, I sent to, you edit this. So if now was then, our movement would be on a higher level. But we learned from a Job. You go there, the regrets I got. Then even some of the board members started resigning because of the things that were happening at organization. We regret to inform you that we cannot be. We have your friend. Brad, we have a friend, we are behind you, but we cannot be what? We cannot be. So it was really not, but it's a unique thing. It's a unique thing to learn. Because now nothing actually, even if I open up a laptop, we regret to inform you that you know, I'm like, okay, next time. Yeah, so I started transitioning, but then remember I had my vision back, health. I'm like, okay, IBU, our mandate, how many mandates do we have? 4. Can we make them 3? With advocacy, yes, I can do advocacy, but that's not my calling, or that's not where my strength lies. Yeah, with advocacy, I work with partners, but can we, drill into health to see? Because for me, my plan is actually, even if I resign from now, because I want also to go and enjoy my marriage. Yeah. So if I resign, I want to resign when we have a well-structured hospital for queer people, not these clinics. Sometimes I sit, I'm like, why do you name us a drop-in center? We are clinic. Yeah. How will you start? How will we move from those carcons of being DICs? We are clinics. I remember in the first concept note of Global Fund, new funding model, they wrote to IBU asking the numbers. So if you can write to a queer organization asking the number to write a whole Uganda concept note, why do you still name us at the GIC? So a challenge. Sometimes I sit in the meeting, I'm like, okay, why am I even sitting in these meetings? We are not DIC, we are clinics. Because I'll brag that actually most of referrals come from mainstream to our queer organization. You know, you say, okay, go to IBU, they have this kind of medication. So why don't you accredit us to be a fully fledged hospital than actually being actually a part of a piece of something? Yeah? So I started like, okay, what are we doing? And also transitioning is not easy by people. For example, for me, I had a challenge with founder syndrome, whereby for me, I'm the longest serving in this organization. Why did they appoint Brant? I was a very young person by then. And people, you know, fighting forces, you know, that really, it was a challenge. Yeah? But actually, thank God for me, I'm a prayerful person. Things happen. The partners that went started coming back because of the engagements I've had with them. And then IBU now starts actually shouting again. Leadership with young people, they in 1 or 3 issues, they need to be supported. They need to learn history. Because for me, I didn't know about what is audit. So I went down and then read about audit. I read about, you know what, the structures. You have a board. What's the function of? So it needs support, reading history, and actually acknowledge what is there. For me, I fear police. I will tell you, if an informed person enters there, I'll be the first one to leave. That's why I've learned to work with partners. If I know that actually Samantha is good with police, it is okay. For me, I can be behind you and support you with all the health issues but then I cannot confront the police. Yeah, it can work. One, the challenge we have with us queer community, we want defiance. And defiance doesn't work now. That's why you always see most of the meetings, they call specific people. When it comes to health, if Brant, you're not attending, it's okay. Yet I don't want it to look like that. I want everyone, even if I'm away, you can attend on my behalf. Defiance cannot work. Because, for example, if I need to know to get more information regarding, say, for example, service delivery in queer community, I have to talk to the queer community itself. How do you talk to a queer community? Befriending them. But if you say that we are here, we are Utusite, we are here, we are queer, we are not helping our people. Maybe that's why we lost actually more than 7 people in a period of 2 months. If we went diplomatically, because some issues need defiance, but other issues not diplomacy. But if I talk, with the heartbeat of it, we need actually diplomacy. Because you find people who are really, have those minds that actually they carry their God on their head, they carry their norms and culture on their head. So if you come out and say you're queer, they're like, oh, no. In the Bible, I remember, I don't know how many times actually I went to orient health workers, and then they pulled out those verses. Someone said, I remember I went with my friend Isaac to orient a certain hospital, and I told her, see, Labachiri, meaning, you see this boy, cute as you, and you're queer. Don't you want kids? Don't you want a wife? Yeah? So all that question, if we had that short-temperedness or defiance, I think we wouldn't be having these kind of queer clinics we have. Advocacy bit, sometimes you need to be defiant. Because with advocacy in Uganda, if you're not defiant, but defiance in a diplomatic way. If you want to meet the minister, you cannot say we are here to stay. Remember that. I'll take you back to the bombastic magazine. The first one, we are like, let us go. But actually, the first edition, we didn't actually succeed. We saw a lot of people being arrested. We saw, sometimes I was with a team whereby some of the team left their books in the bus. You're traveling to Gulu, you leave the books in the bus. You're like, Brant, I remember Morgan calling me, hold you down. Kampala. Because the fear, maybe the approach we used, it was really not good enough for our community. By that time, I was a chance to be I was given a chance to go to Gulu, but you know Gulu, they know English. Bombastic magazine is in English. So it was really, and it was a unique thing whereby it was a whole new experience. How do you deal with it? I remember even actually giving a magazine to a supermarket, and actually after 2 minutes they called me, come and explain. What does it mean? Yeah. So if you didn't have strategies how to maneuver through, you would actually being thrown in prison. So the things do work. The strategy I use as Brant, they really work. Because most of the time, if I enter through Ministry of Health, they cannot deny me audience. If I go to Uganda's Commission, they cannot deny me audience. And now, with CLM, that is community-led monitoring, it has a lot of actually people from all the walks of life, queer people, people living with HIV, men, young men, but they cannot, they listen to us because we tackled the issue diplomatically. But however, diplomacy has also definition. This is non-diplomacy. You go sleep and you go to sleep. If you're going to sleep, are you in a night dress? You have to tell them what you really want. You're like, I'm going to sleep, but ABCD. So sometimes you use even to lie. Yes, I've received a phone call from Mbale, but in Mbale they'd say the LLL because you want to see how they respond. So like, oh, Brant, okay, we shall look into that, blah, blah, blah. So we need both defiance and diplomacy. And also, code of conduct. How do you conduct yourself? With queer communities, I'm disappointed in a certain context. The dress code is really bad. One, you cannot go to meet say a medical practitioner, and you come a meeting with medical practitioners, and you come with a short and sandals. That's why the people I work with at Icebreakers Uganda, they are unique. If I actually send them to a meeting, I'm sure that they will not dress to disappoint me. The first impression, I'll take you back when I was going to meet my first date. The first impression. If I don't catch that first impression, even if you call me 10 times. So we can also use that to integrate it into our queer work, the impression. Like, Brant, you have to, you guys, when we invite you, you dress, but you know, also the code of conduct that has dress code and the way we talk about people. We're now past of saying, we are being killed. Why are you being killed? Evidence. HIV is killing us. Why? You have to present evidence. You know what? HIV is killing us because we don't have hospitals to go to, because there's discrimination and stigma, because we have the enabling environment. Yeah, we have a low in pay. So that people know, okay. But if you go we without evidence, we are going nowhere. Yes, but then the challenge is, the challenge I've seen is actually some people are not strong than us. That's why actually even these fingers are not the same. Because I remember when the bill passed into law, we had a conversation, and one of our consultants asked us, if we take a Brant, who can be the executive director? Like, no. With this law, with this looking of money, but we cannot. A challenge that people have fear. If we deal with fear, yes, even if I walk away today, maybe we'll go on.
How are you empowering the people?
The empowerment starts with one. I always tell people that actually empowerment starts with you. One, yes, for example, I'm privileged. I sit on different actually platforms, and then wherever I sit on different platforms and I see an application, I first look through whether IBU people have applied. Yeah. I've made sure that actually in these meetings for us, I want the ministry to start calling other people rather than Brant. But the challenge we have, some people go for this engagement just for. The passion we had years back, it's not the passion people have now. People now are like, what am I getting there? I've actually empowered my people in the way that actually, even if you're not going to get something, you go. you can get someone that is interested in your what? In your initiative. For example, most of the staff members at IB, you have their own initiative. And as Brant, I cannot actually sit on your own initiative. If you have your own initiative that is not collide with IBU, it is okay. But empowerment starts with you. For me, even if I give you a visa to US, you can reach US and you fail to. How do you pass? If you go to the meeting, do you share? Even if you repeat someone's statement, you've talked about it. You've talked about. I remember one of my workers, my cream workers. That is Elvis, yeah. So I empowered Elvis, and actually it's reached an extent whereby when Elvis was, sent in a resignation letter, I broke down, because that was my right hand man. You're like, okay, even if I'm away, he can run. But he called me and we had coffee. Like, what? I've gotten greener pastures. Some like greener pastures. It is fine. He went and actually is now working with a funding what? Entity. But I repeat, empowerment starts on an individual level. If you feel Brant is going to take you somewhere and tune your volume to talk, I cannot do that. But how do you? That also brings back the code of conduct. Brant, I'm not learned that I have masters or what, but the way I take myself, the respect I have for people, the thing, if I walk into someone's, leave alone actually meeting Ruth in a band, we talk. But if I meet Ruth in a working space, I'll respect Ruth. That's when Ruth will say, every opportunity he has, like, Brant can do it. Finding love is a bit challenging in a queer, I would talk about queer community. One, status. The day I was appointed to be the executive director, I got a lot, very many applications. Because not about love, because of my status as what? I changed. Not knowing that actually I can go 2 months without even getting a salary. Love is actually, I'm a person who loves. I look a stubborn guy, but then for me, when I'm with a partner, that is it. My least relationship was 3 years, and the current one that actually I've been in it was 7 years. Yes.
Not there anymore.
It's not there anymore. It's not there anymore. So love journey is it's not a bed of roses. People expect different things. And actually, in my status, people expect ABCD. And some people are not there to love. They're here to, because Brant is executive director, want ABCD, which I don't. I'm not into that. But I have success stories regarding my love story. My first partner was older than me. By that time, I was 19 years. He was 40 years of age. But we really made a very, very, very beautiful couple for 3 years. Remember, actually, my partner was actually the quiet person. I was a loud person. And by the time, he's 40, I'm 19. I have a lot of friends. I have to go out. I need to be with my friends. And it's like, I need you home by 10. I need you home before what? You understand? So it was a learning that I learned. And that taught me how to coexist with people. Because sometimes Brant is talkative, someone is quiet. So how do you coexist with that person? Yeah. And then that relationship got done. I got into another one. This one was actually, I even actually made vows that actually if it doesn't work, I'll never love again. We walked that journey, and this person was too quiet. In that you could even spend a lot hours in the house without talking. Yeah. So, love is a beautiful thing, but then when you're into work, it cannot happen. People expect a lot, and then the stress we have. Yeah. And for me, if I'm stressed, even my dogs will know that I'm stressed. Even my house facilitator will know that I'm stressed. Even my friends will know. So that stress actually you bring onto people, that is not called for really. That make me makes me question love. One of the strategies I've also used is actually not one. I have a very handsome, beautiful boy. He's making 16 years of age. I had him, but then we had we had a relationship with my mom. Like, for me it was fun. Yeah, it was fun, and I'm not ready to what? To be with a what? With a wife. So mom, wake up and go talk to the family. By that time, I was a very young person. So when I joined activism, a lot words started throwing around. My sisters started questioning. I remember we had a bar called Lyric, where my siblings used to come and enjoy. And this Lyric bar was for queer friendly. So they started questioning me, and I remember some of my in-laws asked me, which team do you play for? Meaning, are you queer or not queer? I'm like, I don't understand what I'm saying, but I had actually grasped it. So also my elder sister started actually, just because he was seeing my queer friends, so she started actually sending me some weird conversation. So what I did is like, okay, Brant, be open. If you want to speak about sex workers, speak about sex workers. If I'm speaking about queer, I'm speaking about queer. If I speak about refugees, then I speak about refugees. So I made my page open. So you cannot tell whether I'm queer, or I'm living in HIV, or I'm lesbian, or I'm a straight guy. So you cannot tell, because there were people I've been with. And also, people work hard. If money, family respect you. Because I remember one of the time my mom made a comment. I'm like, bana abantu boogera nnyo, people talk a lot. Some of the relatives, they say actually you're gay. And I'm like, mami abantu bakola ki? Boogera nnyo. So I don't give a chance for her to have that conversation. Maybe I should have a conversation, but then it will be suspicious for her. And then another good thing is about, I have a sister that believes in me. That is our last born. He knows I'm queer. She knows I'm queer. But actually, even the time my elder sister wanted to confront me, she called me. She's like, Brant, she's going to call. She asked me whether A, B, C, D, F, G. She even asked her about my partner. Like, for me, I told me, Brant is friendly. You know Brant now. So by the time she called me, I had something to what? To say. That's why I've tried to, and also to label. To label my rainbow. Rainbow is in me. Why should I label rainbow everywhere? Yeah? It is me, it is me. So you go what I've also done is actually to also show my queer friends, some of the close queer friends know my mom. So I've made sure that they go meet her, they have conversations and all that. So if she has that thing of me being queer, it is not loud now. Because of that, I've related with her. One, as a person who actually rebirthed health of queer persons in Uganda, because I think it was actually IB through me that people now started actually having conversation of health of queer person. So I want to be remembered as the first queer doctor to ensure that actually queer people get health services.
Thank you very much.
Pleasure.